large numbers of Ohio patients are about to embark upon talking to their doctors, some of them for the very first time. What advice would you give to them as they begin to, as they talk to their doctors?
There's not a right way, and every physician or caregiver is going to be different. But I've got two different suggestions, and one for just in talking to your physician. First of all, I'd recommend any patient actually look up on the internet, and you'll find information about it, to have a basic understanding about the endocannabinoid system, the endogenous cannabinoid system. And just a quick summary is just meaning that we literally have receptors throughout our body for chemicals called cannabinoids. We make cannabinoids, that's why endogenous, they're made within the body, chemicals just like found in the cannabis plant. So this system is very important to keeping us in balance. So the first thing is just ask your physician, your care provider, do you know anything about the endocannabinoid system? Or what can you tell me about the endocannabinoid system? If you get a blank look, like they've never heard of it, or, oh yeah, find out if they know. If they don't know, are they willing to learn? If your health care provider is not willing to learn about this system, my advice is to find another one if possible. Because that's a new discovery on the human body, which really teaches us about health, how to maintain health, how to regain health. And if they don't understand that, they're missing the most important piece of science in this last century. Other than that, I certainly do recommend patients saying, and a lot depends on the condition, but if you've got cancer, I read about medical cannabis being helpful for cancer patients. What do you think? Being straightforward with your physician, your PA, nurse practitioner, whoever it may be that you're seeing, you want to know where they stand right away. And do they answer, I don't believe in it? Again, I would have caution. Don't believe in it. What are they basing it on? Have they read the science? It's not about belief or not as much as it is opening their eyes and ears, listening to patients, but opening their eyes and looking at the science. And I think people can relate to the fact that Sanjay Gupta, very well-known CNN physician, once he looked into it, he came back and said he realized he's been duped by the federal government's prohibition of cannabis. He's been fed lies, as every physician, every nurse, every healthcare practitioner has been fed lies for decades, that cannabis is this gateway drug, leads to amotivational syndrome. The whole prohibition has been based on lies. And once you understand that, you go forward. So if your physician's not willing to look at it, find a new one. But I think just coming right out and asking, because you want to know where they stand.
Mm-hmm.